Maintaining mental wellness can be hard, and the COVID-19 pandemic hasn't made things any easier. For people living in rural and remote communities, there are added challenges involved when trying to stay mentally healthy. Just what are these challenges? Access. Access to mental health services is often limited, both in terms of services and healthcare workers, resulting in long travel distances for patients. And, since fewer services exist, wait times tend to be longer. Risk factors for poor mental health. Occupations in rural areas such as agriculture, forestry, and mining are often dangerous and associated with high levels of stress. Rural dwellers with low socioeconomic status also tend to have increased alcohol consumption, decreased physical activity, and less utilization of preventative services. Culture and stigma. People in rural communities perceive increased stigma around mental health and have more concerns regarding anonymity. As well, strongly held values such as resilience and independence decrease this population's likelihood to ask for help. Isolation. Low population numbers and an increasing population migration towards cities means that living in rural communities can increase social isolation and decrease availability of social support. Together, these factors increase the risk of suicide. The Rural and Isolated Support Endeavour, RISE, was created by a working group of the Society of Rural Physicians of Canada, SRPC Student Committee. Our goal? To address the impact of COVID-19 and social isolation on the mental health of rural communities.
Reflecting back on the early COVID-19 pandemic, I think it's kind of interesting to see how medical students in general responded, and I kind of see it as a bit of response out of, we're supposed to be there at the front line, but we're just not quite there, we're not quite ready yet. And so I think many of us, including the Society of Rural Physicians of Canada student committee members, were looking for ways to help. Myself and the co-chair of the student committee at the time, we thought we would reach out to the network of rural physicians known as the Rural Med Listserv, which is an email listserv that many people would know about through the SRPC. I think the idea of isolation and the impact on patients came about, and so that's how RISE was born.
Right in the beginning stages, Anchaleena, Ella, and I knew that we needed to come up with a really catchy name in order to bring our idea to life. We wanted the name to stand for exactly what we were trying to do, which was reach out to people who live in rural and isolated Canadian communities who are at high risk of isolation and loneliness because of the pandemic. With this in mind, we landed on the name RISE because of what it stands for, which is Rural and Isolated Support Endeavour. We felt that this really emphasized exactly what we were trying to do and was very well suited to our intentions. The word itself, RISE, is also very appropriate, as we were hoping that our efforts would help these people rise above the challenges and the barriers that were put in place by the COVID-19 pandemic.
When I joined the RISE team at the beginning of the pandemic, I became the Outreach and Awareness Lead. This role involved working with my co-founders to reach out to as many rural primary care clinics and healthcare facilities as possible to really get the word out about RISE. Initially, it was just us three trying to get this done, and one thing we really wanted to include on the promotional materials was a logo that represented what RISE was, and I was instrumental in helping to create this logo. We decided to go with a red color and to really catch people's attention. And if you can see, the top of the eye is actually a little comic representative of a virus particle, because we wanted to emphasize that this was truly a COVID-19 pandemic and a response to the pandemic in order to help folks who are living in rural communities who are facing isolation. We also included a little phone at the bottom of the logo as well to emphasize that you could really access this program no matter where you lived, because all you need is a phone. Some people did want to use video conferencing in order to talk with their volunteer. However, most of our clients did just use their phone, and it was very accessible because of that. I was very fortunate in that my mother is actually a graphic artist, or had worked as a graphic artist previously in the Ottawa area, and was able to help us create this logo. And we're very proud of it, and we did include it on all of the promotional materials that we sent out to different healthcare facilities throughout the whole initiative.
Our initiative matches medical students with clients to provide weekly check-ins and social connection via phone or video platforms. We have over 100 medical student volunteers available and waiting to be matched with clients. Our volunteers provide non-medical emotional support and companionship in a variety of languages. There are 2 ways for clients to sign up. With the referral of a physician. Since our medical students are not yet medical professionals and cannot give medical advice, it is in the client's best interest to have their doctor as an important member of the team. Self-referral. Both physicians and clients themselves can reach us at our email, rise.srpc@gmail.com.
Our medical student volunteers are truly the heart of the organization. After they finish their mandatory training, they would call the client every week for 20 minutes to as long as the client needed over a phone or video call. And they were the ones who were there for the client when they were feeling lonely, when they were having a bad day, or when they were suffering from grief after losing a loved one. And they made sure that the clients, elderly clients, had groceries that week. They chatted about current events and listened to clients sharing their life stories. And our volunteers were so dedicated to providing companionship and advocating for their clients' needs. Whether the client was a youth worrying about not being able to spend their birthday with their friends because of COVID, or a mother worrying about her children, or an older adult in a retirement home with dementia, our volunteers were always available for them to provide support. And I really think that the leadership and the devotion that our volunteers showed was truly remarkable.
Through RISE, Canadian medical students are stepping up to stand by people living in rural Canada. During the COVID-19 pandemic, bonds of community have never been more important. Join us and help us to support, empower, and reach out to rural communities, one call at a time.